Hello, class, and welcome to our presentation by Lulu Della Cerda and Stacy Thompson. In this presentation, we will be reviewing what a laboratory operations supervisor is, which is also known in other laboratories as a pre-analytical supervisor, and what that position entails. We will also talk about the common stressors related to this position. We will also provide recommendations on how to improve and overcome these stressors. Let's dive in. So, what is a laboratory operations supervisor? As a laboratory operations supervisor, your primary role for the pre-analytical phase is to ensure that everything that happens before testing begins runs smoothly, efficiently, and safely. Let's take a look into the purpose of a laboratory operations supervisor. As a lab operations supervisor, you are responsible for overseeing receipt, preparation, and data entry of all incoming specimens. First, operations. You manage the daily workflow of the pre-analytical department by making sure samples are processed accurately, turnaround times are met, and all procedures align with established laboratory protocols. These are the fundamental steps that determine the quality and accuracy of your lab samples. Secondly, staff. You supervise and coordinate the laboratory staff handling, scheduling, workload distribution, performance monitoring, and ongoing training. And third, you must maintain compliance with laboratory standards, including HIPAA regulations, to protect patient confidentiality. You must also ensure that safety procedures and quality control measures are followed without exception. Beyond daily supervision, lab operations supervisors take an active role in processing, evaluation, and continuous improvement. This means identifying inefficiencies, implementing new workflow strategies, and collaborating across departments to enhance accuracy and productivity. You regularly review performance data, assess quality metrics, and use that information to refine operations for your lab. During our data collection, we interviewed myself, Lulu Della Cerda. I held this position of a laboratory operations supervisor for 5 years. Through questions, we were able to establish hazards related to my position and further expand our research to scholarly articles. These articles helped us to better understand hazards related to this position and how we can improve those conditions. Labs are frequently inspected by CLIA and CAP. The purpose of these inspections is to ensure quality testing incorporates total quality management and is a part of the accreditation process for all U.S. labs. With these measures put into place, a lab's success depends on its employees. Policy changes and regulatory shifts increase job stress because of the constant updating of compliance requirements. Supervisors are held personally accountable for errors, which can magnify their psychological load. Some stressors related to being a lab operations supervisor include working long hours and overnight shifts, working with hazardous materials, and a lack of work-life balance. According to Lee, the author of Medical Laboratory Manager's Success with Pre-Analytical Errors, 75% of total testing phasing error occurs in the pre-analytical phase, and 26% can cause detrimental effects on patient care. Lee further explains that the cost of investigating and correcting an error is nearly 25% of the laboratory total expenses. This can all lead to a higher psychological load for both supervisors and employees. One of the previously mentioned stressors is working long and overnight shifts. Bogle writes in The Effects of Shift Work on Mental Health that working the night shift is a common psychosocial stressor as it interferes with the body's natural circadian rhythm. This disruption can lead to sleep disorders, chronic fatigue, and increased vulnerability to mental health issues. Because night shifts are not aligned with working normal hours, employees tend to feel isolated, which can lead to an increase in depression and anxiety. Employees working in the lab can experience higher rates of accidents and errors because of their working hours and related exhaustion. The second stressor for laboratory operations supervisors is working with hazardous materials. All biohazard materials come with inherent risk. As a laboratory operations supervisor, it is your responsibility to ensure that every safety protocol is properly implemented, not just to meet compliance standards, but also to protect your employees, maintain sample fidelity and accuracy in reporting, and ultimately safeguard the integrity of the laboratory itself. But we must acknowledge something just as important, that these responsibilities and constant vigilance require and come with their own pressures. When combined, these ongoing demands can lead to physical and mental fatigue, and in some cases, even chronic stress and anxiety. The third stressor is lack of work-life balance. Extended work hours without adequate rest or recreation can take a serious toll, not only on our performance, but on our personal and family life. When you work consistently, this intrudes on the time meant for rest, family, or personal activities. It creates a work-life imbalance that affects both physical well-being and emotional health. According to Hart and colleagues, 2014, when the demands of work make it difficult to meet family or social obligations, a role conflict develops, where individuals feel pulled between professional duties and professional responsibilities.
The demand control support model is a foundational theory in occupational health psychology that explains how job characteristics influence stress, health, and employee well-being. Originally developed by Robert Karasek in 1979 and later expanded by Torres Theorol in 1990, the model highlights how the balance between job demands, job control, and social support determines whether a person experiences satisfaction or stress at work. High job demands increase pressure and fatigue, especially if workers have little autonomy or assistance. Job demands are the psychological, physical, or emotional requirements of a job that require constant effort and attention. Depending on the amount of control employees have at work will determine how effective they perform and the amount of stress they feel. High-strain jobs are common when employees face tight deadlines, safety regulations, and limited decision-making power, often leading to stress and burnout. The DCS model emphasizes that autonomy and supportive relationships buffer the negative impact of workload pressure. To reduce job strain, organizations should promote collaboration, decision-making freedom, and supportive leadership. The Job Demands Resources, or JDR model, emphasizes that every occupation has unique risk factors associated with job stress, which can be categorized into job demands and job resources. The model explains how workplace conditions affect employee stress, burnout, motivation, and engagement. Job demands are the physical, psychological, social, or organizational aspects of a job that require sustained effort and may lead to strain, fatigue, or burnout when excessive. Examples of job demands are heavy workload and time pressure, strict accuracy, safety, and regulatory requirements, exposure to hazardous materials, long or overnight shifts, and emotional demands of supervising staff or responding to emergencies. Job resources are the physical, psychological, social, or organizational aspects of a job that help achieve work goals, reduce job demands, and stimulate learning, development, and motivation. Job burnout is a psychological syndrome resulting from chronic workplace stress that has not been managed well. Burnout occurs gradually when employees face persistent job demands without adequate rest, recovery, and support. Burnout leads to emotional exhaustion, detachment, and reduced personal accomplishments. Burnout is recognized by the American Psychological Association and the World Health Organization as a serious occupational phenomenon affecting employees' health and organizational performance. Burnout arises when job demands regularly outweigh available resources. Contributing factors of burnout include excessive workload or long hours, high pressure and or unrealistic expectations, lack of control over schedules and tasks, poor communication or limited social support, work-life imbalance, regular exposure to hazards or emotionally demanding situations, and lack of recognition or feedback. Physical symptoms include fatigue, headaches, insomnia, and a weakened immunity. Emotional symptoms include irritability, cynicism, reduced motivation, and withdrawal from coworkers. Burnout can be reduced through balanced workloads and staffing, employee assistance programs like work-life balance initiatives, decision-making opportunities, training in emotional intelligence and support, and the encouragement of rest and self-care practices.
Operations Supervisor, you conduct safety audits, ensure your team adheres to OSHA and institutional standards, and promote an environment where accountability and respect for patient privacy are at the forefront. The work environment can be stressful due to many factors, such as high workloads, error detection, regulation, safety, shift work, and staff shortages, just to name a few. All this coupled together, along with administrative pressure, can lead to burnout and a high turnover rate in staffing. Job stressors can be effectively reduced through a combination of organizational support, individual coping strategies, and professional resources. Employee Assistance Programs, EAPs, are employers' confidential services that offer support for work life issues such as mental health, financial, and legal concerns and caregiving needs, with examples including counseling, financial planning, and elder child care resources. Mindful practices for the workplace include mindful breathing, and body scans to manage stress, single tasking to improve focus, mindful breaks for physical and mental resets, active listening to enhance communication, and gratitude practices to foster positivity. Building a strong support system at work with colleagues and mentors can foster a more positive work environment as well. Our team recommends the following for reducing burnout. Number one, improving staffing levels. This can be done through better hiring practices such as keyboard testing to ensure candidates type accurately and with little error for data entry positions. Number two, promoting open communication among staff. This should allow employees to air grievances and suggest improvements within their departments and lab. Number three, create employee wellness initiatives like EAPs, which can result in higher productivity and performance and lower absenteeism. Number four, increase training for staff and supervisors to improve proficiency and reduce errors. Lastly, allow for decision-making autonomy. The last decision may be difficult to implement because of regulations, but it is important to work with staff members on this to make employees feel heard and seen. The role of a laboratory operations supervisor is vital to ensuring laboratories operate efficiently and accurately. Accurate lab results are essential for diagnosis and patient treatment, making quality control and compliance with HIPAA critical responsibilities. According to the JDR and DCS models, unmanaged stressors can lead to burnout, low job satisfaction, and decreased performance. Maslach's research highlights that addressing burnout across six key areas improves both well-being and productivity. Supervisors should prioritize self-care, seek leadership support during challenges, and advocate for adequate staffing to maintain high performance. Ultimately, the team's success, lab efficiency, and patient satisfaction depends on balance of technical excellence and strong leadership. We both wanted to thank our families that supported us during this project. I held this position for 5 years, working nights, and really put all my all into this project to showcase the importance of laboratory work that happens behind the scenes for patient care. The last slide is all the references that were used throughout this project. Thank you for watching our presentation.